Hi, Wally Taylor from Texas Integrative Wellness. And I wanted to take just a minute today, answer a quick question that I get a lot from my patients who I see in my practice with chronic illness, chronic fatigue, fibromyalgia, aches and pains, brain fog, irritable bowel syndrome. And that's, why is Lyme disease difficult to diagnose? Well, in earlier videos, I explained a little bit about what Lyme disease is, what it's caused by, but today I want to talk about why it's difficult to diagnose. Lyme disease is caused by an infection from an organism that's a spirochete called Borrelia burgdorferi. Now, a lot of people say that you can only contract it from a tick bite, but science is now suggesting that there's a lot of other ways that you can become infected with that germ, even including in some cases it can be transmitted from a mother to child through the placenta or the birth canal. In addition, we can acquire it from other vectors besides just ticks, probably including things like mosquitoes, spiders, fleas, biting flies. But in any case, if we do get the germ within our body from whatever the cause, it obviously tries to start to grow there. And these germs have the ability to divide and set up colonization within our bodies. The interesting thing about Borrelia burgdorferi is we know that it's one of the most evolved bacteria, has one of the most genes or different ability to make more proteins than many of the other bacteria in our bodies. And it turns out that Borrelia burgdorferi has an ability to change shape. It can go from the swimming spirochete form, which is kind of the free living form. It can go into an intracellular form. It can go into what we call the round body form, which is almost like a spore. It actually becomes very resistant to attack. We also know that Borrelia can form what we call biofilms. Biofilms are these mucousy-like nests that Borrelia and other germs form in our bodies, in our tissues, sometimes in our blood vessels or our joints, or around foreign bodies, sometimes even in our brains, where the Borrelia, along with other germs, raft up within these mucousy nests for protection. They're protected from our immune systems and even from many of the other drugs and things that we could do to try to help eradicate them. But it turns out that in most cases, it's very difficult to eradicate Borrelia. At least that's what some good science is now beginning to suggest, even though it's clearly very controversial. But in any case, if we're infected with Borrelia burgdorferi, question is, how do you make that diagnosis? Well, first of all, these germs can be very difficult to visualize, and they are unable to be cultured. At least up until now, we've not been able to culture them except in rare lab techniques that are not available to the clinical practitioners today. Also, we find that these germs are very difficult to see under the microscope. So it can be very difficult using standard techniques. One of the ways that we have been trying to diagnose the presence of infection with Borrelia burgdorferi is to use what we call immune techniques. The immune system is our body's system that we use to fight back against many of these germs. And a lot of the ways that we would test the body for the presence of Borrelia is by asking the immune system if it's responding to Borrelia in the body. You might say, how would the immune system respond? There's actually a number of different ways, but one of the most common ways that we use is we measure certain proteins that are made by the immune system in response to the presence of specific germs. And these proteins are fairly specific. By that, I mean that if we can measure the protein in the body, then that most normally means that the immune system is reacting to that particular germ. And some of these proteins that we measure far from the immune system are what we call immune antibodies. There's different types. There can be IgG, IgM, IgA, but they're all unique immune proteins which are specific against certain germs or what we call antigens. One of the things that's often needs to be discussed is the fact that many of these germs, when they're present in the body, they've actually learned or developed techniques to interfere with the normal function of our immune systems. And so it turns out that if we are asking the immune system to tell us whether or not we're infected with a certain germ, virus, mold, or other organism, and we're asking our immune system, it may often be the case that the immune system is incapable of giving us a perfectly clear and unbiased response. Now, what about, you might say, if we didn't use the immune system to try to diagnose these germs, what are some other ways that we might be able to do that? Well, one of the most exciting things that's beginning to be more and more present in the clinical toolbox is to be able to identify the presence of certain germs and infections by looking at their unique DNA and RNA signature. We've known for a long time that every living thing, whether it be a virus or a bacteria or an animal or even us humans, we have our own unique sequences of DNA and RNA, which is kind of like a fingerprint, unique to each one of us. What we've learned to do now is to take specimens from the body, such as urine or blood or tissue or stool, and actually identify all of the DNA and RNA sequences that are within those specimens. And because we've got a catalog now of many of these different other living things, much like a library of books, with each book being the DNA and RNA sequences of that particular germ, we can now just play the matching game and match up the sequences of DNA and RNA in these various samples from the body, match them up to the unique organisms, and by that way we can identify what's going on, what's inside of us. And this is a direct diagnostic technique as opposed to the immune system technique, which is an indirect immune technique. So these are some more exciting ways that we're developing more and more to try to help us identify what's going on in our body relative to the presence of some of these germs that are not us, and can, in most cases, be good, but in some cases can be bad and lead to disease. So this is just a little clarification of why it's difficult to diagnose Lyme, and why it's been so controversial, why so often people are told they don't have Lyme, when in fact, with further testing using some of these newer techniques, it turns out that they actually do. So if you like this video, I'd ask you to subscribe to my YouTube channel so you can learn more. Share this with friends and family, and look forward to being able to share other ways that I can help you learn how to avoid chronic illness and live a vibrant, abundant, and long life. So God bless.